Yoga to encourage trauma release. This is an article in the Minded Institute and released March 1st, 2024. When we're looking for ways to help ourselves heal from trauma, the massive perspectives and information available can be intimidating. And to narrow it down, we can explore the concept of trauma release as it relates to physical as well as trauma release. What is trauma? Trauma is a combined psychological and physiological effects of an extremely distressing experience that overwhelms a person's ability to cope. The distress comes from perceiving the experience as life-threatening, whether the person has threatened themselves, witnesses a threat to someone else, or hears about a threat to a loved one. Post-traumatic stress disorder usually involves a catastrophic event such as a car crash or an assault, disruptive psychological and behavioral symptoms such as depression, memory loss, intrusive thoughts or flashbacks, exaggerated startle response, risky behaviors, avoidance, starting with reminders of the traumatic events and generalizing to many areas of life, impairment of daily functioning for more than a month that is caused by symptoms and not caused by medications, substance use, or a medical condition. Complex post-traumatic stress disorder, CPTSD, usually involves more recent identification. The formal diagnosis may not be under the DSM-5 manual. Everyday trauma. Many people live with similar difficulties but do not qualify for a diagnosis and professional trauma treatment. Especially stressful situations can lead to anxiety, depression, rumination, self-blame, sleep disturbances, distractibility, and other negative consequences of nervous system overarousal, such as digestive problems or autoimmune disorders. These kinds of responses are legitimate challenges and can be thought of as everyday trauma. People struggling with them may search for self-directed ways of trauma healing, which often include trauma release methods. Yoga and trauma. As a multidimensional practice, yoga can affect physical, energetic, sensory, emotional, mental, intellectual, and spiritual aspects of life, just as trauma affects all areas of life. In trauma, nervous system threat responses, which are meant to deal with danger and then subside, become stuck in a pattern of hyperactivity, even to non-threatening situations. Peter Levine, the renowned pioneer of trauma therapy and founder of somatic experiencing trauma therapy, describes trauma as stress response energy getting trapped in the nervous system and blocking the return to balance after a traumatic event. The problem is not only psychological but also physiological, as the nervous system swings from agitated fight or flight states to immobilized freeze or flop states. The immobile states, either poised for flight or collapsed in helplessness, and dissociated states, separating consciousness from physical experience, which experts see as a key element of trauma and are often most in need of release or getting unstuck. Trauma release then means allowing the body to complete the instinctual actions of its natural stress response, so the nervous system knows it is safe to let the excess energy go and return to baseline, thus enabling the body-mind to recognize the difference between past and current sensations, emotions, feelings, and thoughts. Trauma release methods, including yoga, can help reduce agitated, frozen, and dissociated states as they work to bring the nervous system back into balance. Definitions and methods of trauma release. Release is a fuzzy concept. With the trauma, where there may be heightened risks of overwhelm or re-traumatization, avoidance of emotional processing, and increased agitation or aggression, or addiction to the intense sensation of release at the expense of behavioral transformation. Letting go of tension and unblocking energy also appear in the physiological release frameworks of somatic therapies. Cognitive-based trauma treatment. Conventional trauma treatment often centers on changing thought processes, a top-down approach. These methods have received the most funding for research, so they have a strong evidence base and are favored options recommended by most official entities such as governments and psychiatric associations. The top cognitive PTSD treatments are cognitive behavioral therapy, CBD, trauma-focused CBT, cognitive processing therapy, CPT, and prolonged exposure therapy, PE. While cognitive methods predominate, they have not been comprehensively studied for safety and effectiveness in co-occurring conditions or comorbidity and complexity, as they may have adverse effects in CPTSD and not be as helpful. Somatic trauma healing. Although CBT, which is a classical model, does not include working with the body, it's still the most prescribed trauma therapy. Somatic therapies have steadily gained status. These approaches work, as yoga does, through the body-mind connection. Research increasingly suggests that body-based bottom-up approaches may be superior to cognitive methods in addressing the physiological roots of trauma, especially complex trauma, because they work with instinctual adaptive responses to physical and social environments, such as hypervigilance or avoidance. Beneficial aspects of somatic practices include yoga therapy and can involve client-centered or patient-centered care, therapeutic relationship based on co-regulation, increased body awareness of safety, nervous system activation, and relational patterns. Breath awareness and control to improve self-regulation, breath, body awareness, and relaxation practices to increase distress tolerance. Discharge of excess stress, response energy, and muscular tension. Some major somatic therapies for trauma, which may involve both top-down cognitive strategies and bottom-up body-based techniques, include tension and trauma releasing exercises, TRE, formerly known as trauma release exercise or trauma release process. Emotional Freedom Technique, EFT, the Safe and Sound Protocol, Integrated Listening System, Focus System, SSP, and Yoga Therapy. Somatic Experiencing. Trauma release practices entered popular awareness in the context of somatics. One of the earliest and most influential methods of somatic trauma release is somatic experiencing. Its founder, psychologist, and biophysicist Peter Levine noticed that after surviving a threatening situation, wild animals come out of an immobilized state, either posed for flight but frozen to escape a predator's notice, or playing dead to be less enticing as prey. They would shake and tremble, which discharged the stress response energy and allowed them to return to their normal balanced state. Dr. Levine developed therapeutic techniques to help human animals recover their natural ability to discharge energy by completing physical actions similar to those their bodies were prevented from accomplishing at the time of the traumatic event, such as running, pushing, and shaking, accompanied by imagery, breath, and vocal work. During these practices, without explicitly recalling events, they can expand their capacity for emotional containment as well as expression. If meaning and containment are not addressed, the release can be merely an intense sensation used to avoid trauma-related sensations and feelings. As with EMDR and with yoga therapy, the physical release of somatic experiencing is one part of a whole person experience, both top-down and bottom-up, designed to decouple current sensory awareness from trauma-related emotions, memories, and thoughts. Research suggests that the approach, while not without drawbacks, has merit as a trauma therapy. TRE. Another trauma release technique continuously gaining popularity is tension and trauma releasing exercises, TRE. Developed for trauma and extreme stress by Dr. David Berceli, a doctor of social work, psychoneurologist, field traumatologist, and massage therapist. Taking Dr. Levine's work as a springboard, Dr. Berceli created a short sequence of simple physical exercises designed to fatigue forward-flexing fetal position muscles, especially the psoas, to the point of shaking or tremoring, so that they have to let go of their habitually held contraction. This tension release practice is meant to restore the body's ability to let go of excess stress response energy and return to nervous system balance. Like Dr. Levine, Dr. Berceli links the frozen state of tense flexor muscles with avoidance, numbness, and dissociation in PTSD. With any self-directed activity, however, the risks of overwhelm or strain are possible. So out of caution for emotional containment and injury prevention, it's recommended for beginners in any healing modality to consult a trained professional. Social media perceptions. Recent popular trauma release videos on TikTok and YouTube are full of partial TRE tremoring demonstrations, intense hip stretches, and guided cathartic experiences, some of which seem to resemble primal therapy, and many of which end in the client curling in a forward contracted position, which is the opposite of TRE's goal. The demand for self-directed trauma healing is clear, but professional facilitation is needed, at least in the beginning stages, for safety's sake. Attempting trauma release with only an amateur video for guidance may pose risks for re-traumatization or physical injury. Through widely available online and in-person classes with experienced teachers or sessions with yoga therapists, yoga may help bridge the gap between expensive or inaccessible clinical treatment and unsupervised experimentation with techniques. Qualified yoga teachers are expected to be trained in injury prevention, and qualified yoga therapists are expected to have additional training in taking precautions for medical conditions and assisting with emotional regulation. Further training in mental health and trauma is offered at the Minded Institute. Through physical movement, breath awareness, and control, mindful attention, yoga practices combine the top-down and bottom-up strategies for trauma release, defined again as discharging excess stress response energy to return the nervous system to balance. Research suggests that yoga is particularly beneficial for nervous system regulation and adaptation, with practices such as conscious attending to slow, controlled breathing, formal and everyday mindfulness, mindfulness meditation, other types of meditation, sound mantra and chanting, physical exercise and asana postures, various relaxation practices, social support and social engagement, either in a teacher-student or therapeutic relationship or in a group class. These strategies can lead to helpful physiological changes in neural function, brain structure, and activity, and nervous system chemicals that allow the body-mind to stabilize and the person to build self-regulation and resilience. A major mechanism behind these improvements in yoga and mindfulness is increasing body awareness, which research indicates can help in PTSD treatment. Trauma-informed yoga. These classes are not taught specifically for trauma healing, and students are not required to disclose trauma histories. The teacher assumes that any student could be a trauma survivor and accordingly adjusts multiple factors, such as language, posture choices, sensory environment, class size and types of students, student placement, use of props, and physical actions, to help mitigate the risk of overwhelm. Trauma-informed teachers should be aware of multiple sources of trauma, including intergenerational trauma and racial trauma, which can express themselves in the body on all levels, from neurology to outward appearance. It's important for yoga teachers and therapists to keep these in mind as they design practices, courses, and groups. Trauma-sensitive yoga. Trauma-sensitive yoga is a way of teaching yoga that not only reduces the risk of triggering or re-traumatizing, but also provides support explicitly intended for students with known trauma histories, especially those with complex trauma. A trauma-sensitive yoga class will likely help with building basic skills for mind-body connection, agency, and nervous system flexibility. Trauma-centered, trauma-sensitive yoga, TCTSY, is an evidence-based yoga intervention for PTSD and CPTSD. The trauma-focused yoga is a deliberately trauma-focused yoga class. It's designed specifically for trauma healing method. It will be taught by either a trauma-trained yoga therapist or a yoga-trained trauma clinician, and will offer direct instruction for self-awareness and self-regulation, as well as guidance for self-care. To process issues arising from the classes, students must also be under the care of a qualified psychotherapist. Like both somatic experiencing and TRE, yoga may allow the nervous system to release tension and complete actions directed by the body's inner wisdom. For example, in a lengthy chair or warrior posture, which reminds the nervous system of its power to escape or resist danger, is engaging the strong, large lower body muscles of running, climbing, and kicking. Actions can go beyond stress response movements as the client explores their present moment experience and experiments with making choices and taking effective action based on their body's feedback, all of which are known to help heal trauma. Yoga therapy for trauma. Yoga therapy for trauma can serve as an adjunct to clinical PTSD treatment. The Mindful Institute collaborates with the Yoga and Healthcare Alliance and the PTSD UK, who acknowledge that yoga therapy can assist both short-term symptom management and can work to progress towards the processing and moving out of dissociative patterns to go beyond trauma release towards a richly integrated sense of self, empowerment, and well-being. Advantages of yoga therapy for trauma. Yoga therapy may be uniquely beneficial among somatic trauma healing methods. because it combines numerous multidimensional strategies, including high individuation and ready adaptation to changing needs, collaborative client-centered planning with careful calibration of intensity, yogic lifestyle suggestions to develop self-care and help with other medical conditions, co-regulation and a safe, attuned therapeutic relationship, grounding and other self-regulation techniques, body awareness and mindfulness to expand emotional tolerance capacity, while decoupling current inner awareness from past threat associations. Accessible low-impact physical exercise that can reduce stress responses, breath work and vocalizations that can help regulate the nervous system, psychoeducation for top-down integration of theoretical knowledge, and real-world applications with bottom-up body-based practices, further integration through imagery, embodied inquiry, and reflections on meaning and purpose.